Assalamu alaikum. I am Dr. Mohammed Prince Sheikh with you on behalf of the Healthcare House. Today's topic: how to treat an allergic cough at home. Allergic coughing is a common symptom experienced by many people with allergies. Allergic coughs are usually caused by reactions to dust, mold, pollen, pet dander, freshly cut grass, food allergies, and other allergens. This can later cause shortness of breath and lead to allergy-induced asthma. You may be able to relieve your allergy cough with home remedies, but over-the-counter medications can also be of great help. However, you may need to see a doctor if your cough doesn't improve with home remedies. Allergic coughing can be a reaction to allergens. Allergy sufferers have to contend with watery eyes and runny noses as the hay fever season begins. Along with pollen and dust allergies, sufferers also suffer from painful and allergic coughs. Below, we will tell you about allergic coughs, what symptoms are common, and how to treat them effectively. The connection between dry cough and allergies. If the organism absorbs harmful substances such as pollen, house dust, or animal hair into the respiratory tract through the nose and mouth and classifies them as allergens, it initiates an immune response that produces histamine. This substance constricts the bronchi and makes you cough. A cough is the body's attempt to expel intruders from the body. These home remedies can relieve an allergic cough. Your allergic cough should be checked by a doctor. If you don't have an antihistamine on hand or want to relieve your symptoms naturally, you can try these different home remedies. Drink warm water, decaffeinated tea, or broth. Warm liquids can temporarily relieve coughs, itchy throats, colds, and sneezing. Heat the drink until it is warm, but not too hot to drink. Then drink slowly. Honey. A teaspoon of honey can soothe the throat and relieve the urge to cough. It also has anti-inflammatory properties. Add 2 tablespoons, 9.9 milliliters of honey to a cup of warm water or tea. Honey is a traditional home remedy for coughs. Honey is easiest to use in hot drinks, so mix honey with hot water or tea. Then drink honey water or tea twice a day to relieve coughing. Never give honey to babies under 1 year of age, as their gut bacteria are not developed enough to fight off natural bacteria. Inhalation with essential oils. Inhaling steam with essential oils, such as eucalyptus or peppermint, can help open the airways and relieve coughs. Ginger. The spicy root has anti-inflammatory properties and can help relieve coughs. Drink ginger tea to soothe the respiratory system. Ginger is anti-inflammatory and can reduce airway swelling that contributes to coughing. Add honey or lemon juice for extra benefits. Gargle with salt water. Gargling with warm salt water soothes the throat and relieves the urge to cough. Steam bath. Steam is a great way to moisten the airways, which can help temporarily relieve a cough. You can simply fill a bowl with hot water, hold your face over it, and put a towel over your head to trap the steam. Make some changes in your food list. You should note in your regular food list if you are allergic to any food or any vegetables, like hilsa fish, shrimp, duck egg, pushak, pumpkin, etc. If your body is sensitized to the above foods, the level of allergens in your blood will increase. This can cause various dangerous symptoms like itching, swelling, and shortness of breath in your body. So you should avoid such foods. Over-the-counter medications. Medicina such as antihistamines promise relief of their active ingredients, such as cetrazine elytrol, desloratadine, or fexofenadine, block the release of histamine, and thus help relieve symptoms such as an allergic cough or cold. You can also use a nasal decongestant or nasal spray every 4 to 6 hours. Common decongestants include antazole, antazole plus, sodium chromoglicate plus xylometazoline, oxymetazoline, phenylephrine, and pseudoephedrine. You can find a decongestant in your pharmacy's allergy section or online. Consult your doctor before using antihistamines, nasal sprays, and decongestants. Anyone with a particularly severe allergic cough may consider hypersensitization. over a long period of 2 to 5 years. Regular injections can be taken to gradually acclimate the body to the allergen. Treating allergic cough in children. Children can also have an allergic cough, and in particularly severe attacks. It can quickly become alarming, especially when symptoms like shortness of breath occur. Parents should pay attention to the following tips. Steps you can take to avoid allergens. Identify a child's allergic cough triggers and try to avoid them as much as possible. This may include, for example, removing pets from the bedroom, avoiding smoke, or regularly cleaning the air filter. Air cleaner. Use an air purifier with a HEPA filter to remove allergens from the air and improve the air quality in your child's room. Nasal irrigation. A nasal wash with an isotonic saline solution can help relieve allergic irritation from the nasal passages and coughing. There are special nasal irrigation systems suitable for children. Humidity. Keep the humidity in your child's room at a comfortable level to avoid dry mucous membranes. To do this, use a humidifier or hang a damp towel near the heater. Children can also develop allergic coughs. Allergic cough symptoms. Other symptoms associated with an allergic cough include shortness of breath, chest tightness, and a swollen or itchy throat. Allergy sufferers suffer from an allergic cough, especially at night, as pollen levels are particularly high then. Coughing urges can last from a few minutes to a few hours. How to prevent an allergic cough? The most important thing is to avoid allergens as much as possible and take preventive measures accordingly. During pollen season, you should keep your windows closed during the day and change your bedding regularly. Regular vacuuming, mopping, and ventilation can help reduce allergens, such as dust mites or mold. If you suffer from frequent allergic coughs, seeing an allergist may be helpful. They can run an allergy test to identify the exact trigger and provide individualized recommendations for prevention. Allergic coughs can turn into asthma. Don't take an allergic cough lightly. Persistent irritation of the respiratory tract can promote allergic asthma or bronchitis. Daily life is also burdened by a dry cough, and physical exertion becomes more difficult. If you suffer from a chronic cough, you will have persistent symptoms because you are constantly reacting to allergies. Whether acute or chronic, have your cough checked by a doctor. It could be an allergy, but there could also be other ailments behind it. If the cough is not dry and you notice sputum, it is a so-called productive cough. Clear mucus that is expelled may indicate inflammation of the respiratory tract and lungs. A yellow or green color can be a sign of lower respiratory tract inflammation or bacterial infection. Always follow your doctor's advice. Remember that proper treatment and care can help prevent allergy attacks and improve your quality of life. If you like my page, then follow the page to get regular health messages and tips. Thank you.